Tim, I think that you said so many really important things, and without necessarily zeroing in on the trauma and the sort of depth of anguish that you go through, or that one goes through before suicide attempt or experiencing suicidality. What I really loved about what you talked about was how coming through that has given you more focus and has helped transform your life. And it's one of the messages that I think people don't hear a lot, but that I hope people will take away today, is that when you're a person living with a mental health condition, as many, many millions of Americans are, life takes you on ups and downs. And sometimes they can be downs that are very, very difficult, whether they're downs of years of depression and intense feelings of suicide, as I had, or moments. Sometimes I have moments or days in which, even in a business meeting, even facing somebody face to face, I have very terrible internal sensations, emotional dysregulation, as some of us call it, that make me feel like all I want to do is die, hide, escape, leave the room. So I bring this up because I want to point out that part of the journey of recovery is one also of discovery and transformation. And for those people like Tim and others, I think that there's something really important that we haven't been talking about, which is the ability of people who have been through experiences to bring their resilience, their brilliance, and their insight into the workplace and into our culture. So I had a bunch of things I wanted to talk with you a little bit about. Again, I'm Eduardo Vega. I'm the director of the Mental Health Association of San Francisco. I've had about 3 or 4 other careers, including in advertising and legal editing, et cetera. And there was a point, I think, that I always kind of come back to when people talk about suicide, because I think it's a point that a lot of people are at today. It was when I was a young person, I did attempt suicide twice, but one of the things that I remember very specifically was holding a gun and asking myself, based on all I'd heard before, based on my experience with mental health providers, with child psychiatrists, with other things, what was a more dignified choice for me? Was it more dignified to become a mental patient, or to kill myself? Now, I believe that right now there are many, many people asking themselves this question. And as you know, 100 people kill themselves every day just in the US, 40,000 every year, million in the world all told. So to me, the work that I do through mental health advocacy and the development of services and systems is a lot of it driven by what I think we need as a culture, which is to promote the human dignity of people who are living with mental health conditions. There are many, many millions of us, many working for you, many people in this room. And in addition to what we who live with mental health conditions sort of can contribute, just as other good people who are contributing on every level of society, there is something special that I believe that people can bring to their work and to their lives. It's part of it is through this journey of transformation. Sometimes that happens right when someone hits bottom, right when somebody is at the point of killing themselves. Sometimes that is the transforming moment in people's lives. And so I'm saying this because I'm not suggesting that we should compel or drive people to the point of despair. Absolutely not. But that we should recognize that the human experience that underlies suicide, and that the pain and isolation that many, many people feel is something that is important, and it leads to health conditions and to issues that you can work on in your workplace. So I don't want to take up too much time today with my personal story, but I will say that like Tim and like many other people, my experience of suicide led me to a lot of understandings about how to change my life and eventually really focus on my strengths to help create better systems to help other people. And the one thing that I always want to sort of focus on is that when I was suicidal for many years, when I was both at the most intense points at which I tried to kill myself when I was younger, and then on an ongoing basis, the one factor that really I felt worked against me was the feeling of isolation. Now, partly I bring this up because, David presented some things about risk factors and also protective factors. The opposite of isolation is connectedness. The opposite of despair is hope. You can, in your work and in your workplaces, you can promote hope, you can build connectedness. You can support people living with mental health conditions in all sorts of ways, both as leaders in organizations and also in your community, and make a difference for suicide prevention. Suicide prevention is not just something that happens to stop somebody from falling off a bridge. It's a part of creating a healthier community. So at the work that we do at the Center for Dignity, Recovery, and Empowerment, for example, a lot of that is driven around creating new resources and supports so that people don't feel isolated. We work on developing anti-stigma projects, for example, and we do some big ones in organizations like PG&E, Pacific Gas and Electric, where they have a high level of male suicide, to help break the silence and create a culture of change in which it's okay to talk, it's good to talk, and beyond that, people's dignity and contribution is promoted. It's always one, when we talk about suicide prevention, one of the questions that I always kind of come back to myself is preventing people dying from suicide enough? Is just stopping people at that last minute from dying enough? I do not believe it is. Now, of course, I want that to happen. I don't want people to die, especially we don't want people to die in despair and isolation. But by creating healthier communities, whether it's in a workplace, whether it's in a neighborhood, or even a nation, we can make a huge difference that will save lives, but that will also reduce despair and create productivity and an atmosphere of hope. I want to point out a couple things because I always like to leave people with a few things that you can do and a couple asks for you as business leaders. So the one thing I really want to say, again, going back to this message about dignity is, please work to change the culture of stigma, shame, and fear, which we all live in, around mental health conditions and around suicide. And suicide in particular is one in which there's a lot of fear built in. But for those of us who have gone through it, it might be a part of something you're thinking about every day, all the time. To be in an atmosphere where nobody will talk with you about feelings of wanting to hurt yourself or feelings of despair that you're having or the desire to die, that fosters more isolation. It works against what we need. So working against stigma, there's really easy ways you can do this in your workplace. Bring in speakers bureaus, people like Tim and others who can tell their stories and promote hope and show others that recovery is a reality. And in addition, foster conversations so that mental health and wellness are a part of your everyday work life. You can do this through brown bags. A really important thing for me is also sort of focusing on conversations around support and building supportive communities, promoting social connectedness, and in particular promoting recovery, peer support, and personal resilience. Like I said, if you can get a chance to read David and Goliath, the new Malcolm Gladwell book, there's a really great part about it where it talks about how people's adversity and their challenges have created great strengths both for them and for society. Just a little question about, or a little example of this. Not too long ago, a person who was working for me was having very intense suicidal thoughts and feelings. She attempted to kill herself a couple times. She was put in the hospital. She was having a really, really hard time. So at one point, we invited her to my house, and she stayed for a little while. And she was saying, look, I'm having a really hard time. I want you to take knives and scissors and things like that away because I feel that I might hurt myself. And I said, okay, yeah, sure, we'll do that, definitely. So this is a great example of a collaborative approach, not based in a hospital, of keeping somebody safe, based on her expressed desires. Now, anybody have an example, have an idea of somebody else who expressed that same thought and was in that same situation? I'll give you a hint, they're very famous. Abraham Lincoln, thank you. While he was in the White House, suffered very intense suicidal thoughts and feelings, and asked people to take knives and scissors and stuff like that away. It was very important, and what I'm trying to say here is we are not other. We're a part of every sector, every work sector. We work and succeed in all domains of life. Family members, we're parents, we're lawyers. And so people with mental health conditions are contributing every day, including people experiencing suicidal thoughts and feelings. I think employers have a great opportunity to foster change within their culture by focusing on promoting dignity, challenging stigma, etc. So I want you to join the cause for dignity around mental health because there's a lot that's working against us. There's a lot of messages out there about people with mental health conditions and mental illnesses right now. And the intention to blame people living with mental health conditions for social problems, etc. I'd also like to ask you to invest in local programs and nonprofits that are using people's lived experience, that are bringing heroes, messengers of hope to the mix to create new programs, including peer support type programs, including community-based mental health projects that really are based on self-determination and dignity, that are not based around the idea that people need to be contained or constrained or managed, but really driven by empowerment. And then I want you to ask, this is a little bit technical thing, but I really would like you to think about seeing what your health plan provides. So recently, and again, I work for a mental health association, but we've had several people denied coverage, both psychotherapy, inpatient hospitalization, all sorts of stuff like this. If this is not happening to you, I would be surprised. But the point is that even though we have parity as the law of the land now, mental health parity, implementation of that is not coming forward. A lot of the new health plans, particularly if you're in a state where they do healthcare reform or they have health exchanges, are doing everything they can to manage and to get away from their obligations to provide good, consistent, and necessary mental health treatment. I'm really hopeful that you will really work to make sure that whatever you have in existence right now for your employees, and this is above and beyond employee assistance programs, is really going to meet the need that people have and the level of need they might have to get beyond their most difficult points, to live successfully with mental health conditions as most people do, and to be the best contributor that they can be within your company and agency. So, that's all I have. Thank you very much.